You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
North Carolina, English Black. How are you?
I'm great. Thanks so much. How are you?
I'm great. Thank you. Want to chat a little bit about your business endeavor because it's interesting, especially from a medical point of view. Not too many people are doing this. Can you give us a little bit of an overview of where you started, what are you doing now, and what's your why in general?
Sure. Yeah, I started my career 23 years ago as a physician assistant in emergency medicine. All of my pre-PA experience had been in dermatology. I thought maybe in my youth that might be a little bit too boring from a medical perspective way back when. But then came to find out I took a job with a physician going on maternity leave and ran her practice part-time and fell in love again because of being able to treat a range of ages and still find cancer, save people's lives, but also do the fun stuff and helping people feel better about themselves. I had been quite averse to aesthetics, though, from some personal experiences growing up, until I had a baby and was given a job at a med spa in Chapel Hill. I actually applied for the medical dermatology position, and they were like, well, we don't need another medical derm provider, but we would love for you to inject for us. And I was like, well, I had a newborn at home, and it was a great opportunity, super convenient for me practically. And I thought, well, maybe if they like me enough, they'll let me do the medical derm too. But then I had all of these accomplished academic CEOs and professionals coming to see me that just wanted to be treated as they always had, that were maturing and not as youthful and didn't want to be judged or treated more harshly. And so I found my niche in being able to use aesthetics to help people feel great about themselves without distortion or feeding into body dysmorphia or any of that wacky stuff.
Very interesting. So you went on your own, basically, right?
I sure did. About 3 years ago last month.
Oh, wow. Okay. How's it going?
Oh, it's going so much better than I ever could have imagined it would. The private practice that I left, my practice was about 80% medical dermatology at the time and 20% aesthetics. I've lived in Greensboro about 4 years, 3 years at that point. And so when I opened, I just thought, well, I think I can break even. But I knew there was a need in our community for somebody that specialized in facial rejuvenation, somebody that did it very ethically, and somebody that was very dedicated to the craft, just doing the best job, period. And I could not believe that the first year we blew it out of the water and broke $1 million. So that was mind blowing, and I actually got a little misty eyed the other day thinking about how mind blowing that is to walk into that
Yeah, it is.
situation.
It is.
Yeah.
And obviously no insurance-based payments, correct?
Oh no, it's all cash based.
Yeah. Yeah, that's great. And it's one of those things that kind of grew so much over the past few years.
Yes.
And it seems like more and more people are thinking about opening this kind of services for patients. And I want to kind of circle back on the fact that for some reason, physician assistants are very well placed, I would say, in this niche.
hmm
Why is that? Why do you think patients in general would prefer you over a, let's say, I don't know, a plastic surgeon or a full boarded dermatology doctor?
That is a great question. I love it. So I think the first thing that I would go to, and I can speak from my own personal experience, in that my education, well, the PA education in general, is based on a medical model. They're trying to cram 4 years of medical school into 24 months, minus an internship and a residency afterwards. So it is based on the medical model. So PAs are trained to think like physicians do. It's obviously not the same training or to the extent, but it's based on the medical model. Now, what's different in a PA training versus a physician is, well, at least in my program, a lot of emphasis was placed on patient counseling, on patient relationships. And oh, by the way, you're the PA. You'll probably have a little bit more time with patients and use that time wisely. And I learned early on that I do a great job at articulating in regular language counseling, what to expect before, what to expect after a procedure. And that goes for simple excisions or for a medical procedure or for an aesthetic procedure. No one likes surprises. when it comes to your money, your health, and your face. So having that kind of heads up and anticipation fosters trust. And I think the pressure in medicine these days to crank out numbers, in the ERs that I worked, I only did emergency medicine for 4 years. And my first job was in an 80,000 census a year hospital. And the pressure to see X number of people, and I was always in the top 5 most productive, but I can tell you that the patients we saw probably did not always feel the most attended to because got to keep going. You might have a 6-hour wait. And then in dermatology, it just seems in medical derm, over the last 16 years, we get 5 to 10 minute patient slots. And that's just not a lot of time, and you do all the things to give the illusion that we're spending more time. You sit down in the chair and ask some personal questions. And again, I got to where over a period of time where you can do that while you're seeing patients. But it dawned on me several years ago. I was like, I don't think I can do this the rest of my life. I don't think I can keep this pace. I'm going to burn out. I mean, I'm feeling a little bit like this is a lot, which is a lot for me. I feel like I've got a lot of energy. So.
Yeah. So in terms of cost, where are you compared to other offices in your area and compared to offices that are, let's say, some people would say more qualified to do this kind of things?
Sure. Well, for our area, we are definitely one of the top tier. There's very few people that have been injecting for longer than 10 years these days. Most, at least people that focus on injecting. Obviously, my medical director is a plastic surgeon. He's been injecting. He used to inject radiesse in people's lips, which nobody does that anymore. But there's very few injectors, PA injectors, nurse injectors that have been around for that long. So I feel, and I because of all of the investment into ongoing private training, which removes bias from industry, I think that, and the skill, the before and afters, they speak volumes. And so, yeah, we are top tier. I'd say that we're, probably, well, it's actually from a toxin and a filler standpoint, we may be more expensive than some plastic surgery offices, but that's because that's literally our focus. A lot of surgical offices, it's more the med spa is an accessory to support the surgeon or to support the ENT practice. It's not necessarily the business, whereas that is all we do. That's all we do.
Yeah, that's an interesting concept. And I'm wondering, like, from the patient point of view, what do you think the psychology of a patient is when they come to your office? Like you said, nobody wants to be like fool around with their faces, right? So they need to have that assurance that once they step into your office, the job is done correctly. And obviously, I don't think the price point is something that they're worried about because I'm assuming, whenever whoever is stepping in your office assumes there's going to be a significant cash payment, but it's about the quality and the trust. How do you establish this with patients?
That is a great question because that is what I spend the majority of my time to build, not only in my office, but also from our brand perspective, socially, because I feel like there are I perceive two sides. There are the subset of patients that they don't want to screw around with their face. They do want the best result because they understand that there is risk involved, even when a provider is incredibly accomplished and experienced. There's still risk involved. Then there's another subset of people. And unfortunately, these people see the skill as it being the art, not the artist. They see the time. For example, have you heard the story about Picasso when he drew a picture on a napkin? And
Yeah.
then the lady said, well, how much? He said, well, that'll be $400. She said, well, that took you five minutes. He said, no, it took me 20 years to do it in 5 minutes. And that's what I think about all the time. And also I know that we deliver a level of care, concern, thought, and follow through that is just not considered standard in our industry, frankly. But some people, they will pay more and then they think, well, maybe I can save a little bit here and there. And a lot of them come back because they're like, well, I tried it. It just wasn't ever as good. And
Well, yeah, I think, this is one of the fields that I would imagine, and I want your confirmation here. I would imagine someone would correlate the price with the quality. Is that true?
sometimes I think sometimes they hear the price and they're like, no way, I'm going to go find this cheaper.
Yeah.
But again, it's not the products that overfill someone's face. It's not the products that that give people complications necessarily. Now there's a caveat to that, but it is the provider administering that, or it's the artist delivering the art, you know? So
Right.
it's an interesting thing. A lot of providers have this misconception that we can just take a weekend course and now we know how to inject Botox. And Botox is more like math class in that it's here's a medication, here's a dose, here's where we put it, but there's still an art to it because everyone's anatomy is very different. And if you don't completely understand all that and the nuances of it, then it doesn't translate. And filler is just a whole other ballgame. So, but the people I believe that understand the complexity and the nuance of all that, they come in prepared. I mean, and actually it's interesting when we have run sales and specials, that does not change our business very much. People, they come to us and they want a result. That's what they want. It's not and
Yeah.
that is what I encourage. I'm like, you are not coming here for a syringe of Juvederm. You know, you're just not. You have an idea in your mind's eye of what you want to look like when you leave here and how you would like the world to perceive you. More importantly, how you want to perceive yourself when you look in the mirror. You want to feel good, right? Which
Right.
is like a whole nother interesting can of worms.
Yeah, it's it's interesting. I'm fascinated by the fact that the price correlation with the quality of service is not even a consideration for you, because the patients, like you said, they want results, and they sometimes they don't even care about how much it costs or if it's on sale or whatever. And the provider, it's not necessarily a provider. I wouldn't call them a provider in your field. It's more like the artist.
It's
Yeah,
true. It's true.
right?
It's like
Because it's not, when I say provider, it seems like something demeaning at some point. I'm providing some like aesthetic service. What is that?
it's so
That's more of an art. And it's an art. I mean, if I would do this on my face, I would want someone that, it's an artist in what they're doing, right? Um,
right, for sure.
yeah,
Yeah, and it's that marriage of medicine with artistry. And so interestingly, I started out as a medical provider and then moved over into that. Michelangelo started out as an artist and then studied cadavers to become the best sculptor. I mean,
yeah,
and his study was just remarkable, you know?
right. And I'm sure there are horrible stories too that you have, or that you know of. And I wanted to ask you actually, obviously you're successful now, you have your business, you're well known in the community, you got a clientele, but I'm sure you probably had some failures along the way or something that didn't go right.
For
Any
sure.
example of this that kind of, stopped in your tracks and thought about it and move forward better?
Oh, that's so funny you say that. Actually, when I first opened my practice, I was like, I don't know that I don't know. This comes with risk. I don't want to hurt anybody. And can I continue this? I mean, and that nothing had even happened. But it was just a whole new level of literally owning not only your own business, your own practice, but I have assumed the care completely of everyone that walks in the door. And I take that responsibility extremely seriously. Now, back in the day when I first started, when I really became dedicated into injectables, in those days, there weren't a lot of formal trainings. There weren't really classes you could sign up for. The ones that did exist, they were geared primarily toward physicians. A lot of them didn't allow physician assistants, nurse practitioners, or nurses to come along. And even worse, then they did not. No one discussed complications. And I say worse because a lot of the physicians hired PAs and nurses to do these procedures, but then they were not allowed to be included to actually do them well or responsibly, for that matter. So, but yeah, back in the day, I mean, we would have complications, and no one would talk about it. No one had complications. And I'm putting up my little parentheses here because that was very upsetting because you knew that couldn't be true because if you do this enough, something will happen eventually. And then it just is kind of nasty. I do love this story though. She's big on social media. Her name is Dr. Naomi in Australia. And this just to put a date and a funny on how small our world is. Back in 2014, when a cheek filler that was new on the market, Voluma, had come out, this was before we knew to counsel people not to go have dental procedures. Long story short, my patient went and got a crown the day after she had cheek filler. And she came back the next day, her cheek swollen. And it's like, oh no, obviously something's connected, but there's no literature. You look on the internet, there's no information, except I found her blog way back then. And I'm such a nerd. I actually printed out the blog post because she only had 5 reported cases worldwide of this post-inflammatory swelling after trauma around the mouth. And so to tie it all together, I've been following her on social media, but I was organizing my office the other day and found that printout, and it's her. So I messaged her and I was like, "You're not going to believe this, but I have a blog post from you from 2014, and you were my only hope way back then because nobody else would talk about what antibiotics were most appropriate. We were just kind of guessing, but there she was, way out in Australia."
Wow, that's a nice
And
story.
yeah,
Interesting. Um, I want to kind of switch this and focus on you a little bit. You are someone who kind of took a risk, a big risk, initially. And you're in medical field, you're a
mhm,
woman, you're a mother, you're a wife, and you're a business owner.
mhm.
How do you do them all?
Oh, yes, a lot of days I don't know. And I when I opened, I just had to believe. I had to believe, and I don't know that that was even a super conscious daily thought, but I knew I just had to dig deep and believe in myself that if I took care of people, did the right thing every day, and not only believed in my craft, but believed in my skill, believed in my patience, that it would all come together. And just the grace of God, the grace of the drive, the support of my family, and the kids, it's a lot for them, but I love modeling for them that mothers can have their own identity, be
Yeah.
successful. My son's told me he's so proud of me that I have my own business. It's really precious.
Yeah, that's a great point. I think, sometimes people don't realize that we are models for our kids. And no matter what risks you take in your life as a parent, in this business world, especially coupled with the medical field,
Hmm.
it's a huge risk. And, some people have to have that grit that you're talking about to keep going despite failures.
Yes,
But in the same time, it's the best model for your kids to see what can be done. And even if they're not going to that field in their future,
right.
but it's the
Yep.
ethic and the professionalism of a parent to show that to their kids. That's a great point.
Yeah, and I love medicine for that. Medicine is made for lifelong learners, people that love to learn.
Yeah.
And yeah, was that why you went into it? What was your motivation?
Yeah, it's funny you said that. I got this from my mom, right?
Hmm.
She was a woman, a wife, a mother, a business owner, and a dentist, and she
Oh,
showed me these things can be done, and I didn't realize at that time. But later on, when I got into high school and think about what I'm going to do, it was a very straightforward decision looking at my family, and I was like, yeah, that's if she could do it, I can do it.
that's so cool.
Yeah. Did you have any business training prior
None.
to this?
None.
Because
No,
this is one of the things that most people are telling me that, it's trial and error, basically. Kind of,
it is. Well, and I'm really fortunate. I'd done a blend of medical and aesthetic dermatology for years. And then my job in Chapel Hill, where I started out solely injecting, they had me running effectively as the medical director of the spa portion. So I would give patients clearance on pigmented lesions to be lasered. And in hindsight, I didn't even understand this until I opened my business, but we had a fantastic self-made culture where we all worked together remarkably well in a shockingly small space and planned events. We planned specials. We kind of ran the business with the exception to cash flow and how that would be divvied up afterwards. So from that perspective, I was really fortunate because I'd kind of done it from that point on. As far as a business owner, it's really what to do on the back end, as far as cash flow and decisions for lasers and things like that. But I was just fortunate to have already had exposure. I didn't come into this blind, as far
yeah,
as how it goes working with reps and device reps and yeah, just that whole perspective. And as far as the business goes, the choices I have made have been relatively simple because it's been based on patient need and demand. So when they come in asking about XYZ, I'm like, well, boy, I'm hearing a lot about that. I'm going to start finding out more. For example, like a BBL laser. We have a lot of Caucasian patients, and it's great for red and brown. And actually, most recently, we introduced medical dermatology visits, but it's direct pay. So we don't accept insurance, but we have gotten an electronic medical record so that patients have a super bill and can file their own insurance claims. And that was born out of the need that there's like a 9-month wait in our area, at least, for patients to get into a dermatologist and or have something removed. So there's another PA who's been around like me for 22 years. And that's
Yeah.
another thing that we've added, another layer of need that we can serve in our community.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
Yeah, that's very, very smart to do. Now, speaking of cash flow, you know, obviously you're running a business purely on cash payments,
Mm-hmm.
and this is, I would say, a question that I want to ask about. It's very easy to get lost, I would say, in the cash world. Um, how do you manage your business on a cash payments? How do you reinvest your profits? How do you make your investments maybe in other things that you think, you want to participate in for your personal retirement, for your personal well-being after you don't want to practice anymore?
Those are great questions. And I will start the answer by saying I'm still learning. I have read Profit First. I like that concept a lot, maybe not literally, but taking the percentage out of the business on the front end. But what I have, just like I had to believe in my ability to open my practice, I am believing in my ability to grow myself to do bigger and better things. So I have invested so much of my earnings into growth and to business coaching and to learning. I know this is a weakness. I'm not business educated, even though I don't think you have to be to run a business well, but I know there's a lot about this world to learn. So it's particular, it's dependent. A few years I've invested it into learning with some of the best injectors in the world. And then the last year and a half, I've still done that, but I've also invested more in a more business centered place, and some in aesthetics and some in just business in general in our country, because I feel like that's probably going to be more well-rounded so that there's a little bit less bias and more creative thinking as far as how to do those things. But simply put, I mean, aesthetics is an extremely high overhead specialty. So as I started out, I would not order more Botox. I would not order more filler until I paid off the last batch that I bought with the profit. And then again, as far as the devices go, or lasers, I would purchase based on need. And then I would not buy. My plan was to pay off my first until I bought another one. But then again, based on need, we were doing so well with the first one we bought that we bought a second device. And I think we're in a pretty steady stream right now, and until we grow. Our market's been pretty saturated. So our cash flow has certainly been affected, as there have been 3 med spas that have opened up within a block of us and just in the last year. I know. And I don't think that much about it because frankly, the injectors are brand new. They've not been injecting for very long. There have been a physician and a CRNA from another specialty that have opened up not far from us as well. But again, these are all people brand new. So it's just business, and we're gonna ride the wave. But yeah, cash flow is always something to be thinking about, isn't it?
Yeah, absolutely. Yeah, I was about to ask you about competition in this field, and I can imagine, the more I look at this field, the more I see things popping up every street corner,
Oh yeah.
and everywhere, and everybody seems to be so confident in doing these things, and I'm just thinking for myself, like you said, it's a matter of like the artists that they're doing those procedures with. So I don't know where this is going to go. But I wanted to ask you, do you think this is a franchise opportunity for you at some point?
Well, I am dedicated to a very personalized boutique experience. And so I do have a vision of expanding an ethical very high-end experience for patients. Now, how to reproduce that, I think, is still in my mind's eye of how to do that well, how to do it responsibly, and how to scale that. But it's definitely been on my mind because it's, as you said, there are places popping up everywhere. And the difference between when I started, which there wasn't a whole lot of noise and there wasn't a whole lot of training, and that now there's training everywhere. You don't know, or if you haven't been around, or even if you have actually, because I've kind of been off social, most of my career, if you don't know who's truly good, unless you are in the know in the community of talking to the people who are very good, because it's interesting, people are influenced by industry, they're paid by industry, so you really have to do your sniffing to find out who is actually going to do the best education and the best treatments. I'm saying it's on both sides of the street, from the patient perspective, choosing a provider, and then from a newer provider, choosing somebody to train them, because the quality of training varies greatly. And, it's easy to speak with a lot of confidence when you start out new doing this. And just like coming out of medical school or PA school, you
Right.
have to have some of that ego in it, or you couldn't do the job. But the problem is you don't, what is it? The eye doesn't see what the mind doesn't know. And so, if you don't know what could possibly happen, you're not aware of all the repercussions,
Well, exactly. If you don't have enough exposure of what can potentially happen, you're ignorant, I would say.
Yes,
Um,
yes.
yeah,
Yeah, I'm
and
a big fan of setting up, if there is a new injector artist, they need to have someone much more experienced on hand,
yeah,
because really there's no other way. There's no one around to ask questions to. If
right.
there's not, you're literally in the dark. And sure, you can talk to people on the phone, but it's just a different experience, different learning.
Yeah, and it's don't forget, people forget this. In medical world, the first rule is first do not harm.
That's right.
And
That's right.
especially in this field you're in, if you don't apply this rule,
I know.
this can go really bad.
They sure can. I mean, and there are all kinds of stories, and even in experienced hands, even in
Yeah.
experienced hands. And I was kind of shocked because I have had my business for 3 years, and about 6, 7 months ago, I bought the first ultrasound, I think, in our entire geographic area. I mean, there's businesses that have been around for quite a long time. So, what will you do for management of vascular occlusions? And
Right.
that's because that's the biggest, scariest thing that can cause blindness. And that is the most terrifying thing. It's not common, thank goodness. And there's techniques that you can use to minimize that risk. But I'm still surprised that I'm still the only one with an ultrasound. But the way I look at it also is it's just another example of the level of care that we deliver, and
Yeah.
and another layer of protection for both the patient and me.
Right. Right. Um, with all this experience you have right now and the fact that you are successful in your field, you learn a lot along the way. If you would look back to yourself when you started this whole thing, what do you think your advice would be for yourself?
Oh, well, that's a great question, because, like I said in the beginning, I didn't think I would ever be doing this. I love this question. Um, I'm gonna have to think about that. I think the advice would be to be more open-minded to possibility and believe in yourself. I don't
Yeah.
know what your experience has been in medicine, but medicine is cut.
Yeah.
I don't mean cutthroat I mean it in the sense that that's how we are taught.
Yeah.
It's how information is, the gravity of it is tried to be conveyed by teaching you kind of harshly. And so everybody wants to do it really, really well and is so tough on themselves. Um, and then that keeps you kind of closed-minded, trying to do it just right all the time. And it doesn't always have to be that way. We could be more open-minded to possibility. And that for me, actually, as a provider, was transformational in my thinking. Because yeah, we are all taught about a differential diagnosis, but I mean, outside of a differential diagnosis, I mean, I actually have a rare lung disease. And so thinking about that took 2 years to find, and it takes getting out of all of the providers that have lost their creativity, because we see the same stuff all the time. So learning to be open to the possibility is not only helpful for us to learn, but it's also it only benefits our patients, because the reality is none of us know it all, you know, and it's
That's true.
protective, but
Yeah. It's
yeah,
humility.
humility,
Um,
man, it goes such a long way.
yeah. Yeah. Especially in medicine, we need to be humble. We need to keep our heads down because you never know. And so at some point, there's something out there that we can't control, although we think
Yeah,
we can, but we can't.
that's
Um,
right.
where do you want to go with this? What's your plan? What's the future?
My plan is to continue to serve our patients and to the very best of our abilities. And so we've been growing. I plan to move us to a larger location. We've got to find the right fit. I have a place in mind. It's a little large, but that's the direction that we're headed into at the moment.
Very nice, very nice. How can people get in touch with you then to
Yeah.
learn more about this?
Yeah, they can follow me on Instagram at The English Aesthetic and on Facebook as well at English Black.
Thank you very much.
Thanks so much for having me.
It was very interesting, and I hope people will look into these things with the right providers.
That's right. That's right. Thank you so much. Yeah, we have lots of information about how to choose that right provider, no matter where you are in the country, on our Instagram. So be sure to check us out.
Awesome.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.